Welcome back to Midday Kentucky, everyone, and I know firsthand what it takes to have someone come into your home and make that decision that you do need some home care. Let me introduce you to Jackie Howard, who's the owner, and Teresa Foster, Office Manager of Alliance Medical and Home Care. How are we, ladies?
We're good. Thank you for having us.
And I was just thinking to myself, I remember when it was time for us to make a decision to have someone come in and look after our beloved grandma. And she didn't want it at first, but then she realised it was a godsend and she just loved having someone there. Teresa, tell me a little bit about how you deal with that to begin with. If someone's a little reluctant, but their loved one's saying it's time.
Well, when it's time, we like to do a meet and greet.
Yeah.
We also like to go over what they need into the home, what kind of schedule they're on, what they would like to do. And then also we would like to have our staff members that we're thinking of putting into that home so they can do a meet and greet, because a lot of time it is a personality.
Okay, well, how do we know the difference between home care and health care?
Okay.
Give us the breakdown of what we know we should be doing.
The simplest way to remember the difference, home care is non-medical and non-clinical.
Right.
Home health is medical and clinical care.
I understand. It was the question that I wanted to ask you last time you were in. How do we know? There's got to be some red flags that we see at home when we go to visit our loved ones or our mums, our aunties, you know, or it could be someone who's had an accident. Right. You know, what are some red flags that we should be looking out for? And I don't necessarily mean elderly, you know, just anyone.
Right. A decline in one's hygiene. Perhaps the house is not as tidy as it had been at one time. Maybe the person has lost weight, has not been preparing meals, so that is something that our folks will do. Yes. Some other things, Teresa?
Maybe a little confusion. You might notice some slips or falls that are occurring, you know, off balance a little bit, that they may need help.
Maybe the mail not getting checked regularly.
Or they're not taking their medication
in
a proper manner, on a timely manner.
And I think that might have gone into my next question. Who is the typical home care recipient?
Is usually the elderly.
Really?
And then, but also, we've noticed too, we've had some people that are in hospitals from surgery has called us once they go home for help as well.
And I was about to say that, you know, for someone who is single like myself, and I need to have an operation, and I don't have any family here.
Correct.
You know, we want everyone to know also that Alliance can take care of that.
Absolutely.
And so don't feel that it's just for the elderly.
That's
Do you have quite a range of age brackets calling you to take care of them?
Typically, our prominent patient would be the elderly, but if a mother comes home with a newborn and doesn't have family in the area to help her, they sometimes call us for assistance, especially if the father has to work and she's home alone. But as I said, the majority of our cases are the elderly.
And see, and I'm just sitting here when you're talking to me about that, I'm thinking about mums that maybe have had a cesarean.
Right.
And dad's still got to work. He can't afford to take time off. But mum just needs help a few hours a day just to get up and about. You know, these are the type of people that you're talking about. Interesting question coming to you from one of our viewers wanting to know more about, is there a time frame that it takes if you have to sign up? Like, let's just say I call you, do I have to sign a contract for like 3 months to have you, or it's just case-by-case scenario?
Case by case. Each individual is different. We know each need is different. So once they call us, we do require just a 4-hour minimum. There's no long-term contract for that.
Oh, wonderful. I think that's
everybody's
fantastic.
needs are different and everybody's needs changes.
I totally agree. Teresa, Jackie, thank you so much. If you want to find out more information about Alliance Home Care, there it all is up on the screen now. Now do remember, Alliance Medical and Home Care, the website's fantastic, everyone. I went on there just before the show to have a look as well. There's the phone number, 859-296-9525, or you can give Jessica an email as well. Thank you so much for both coming in. Hey, after the break,